One of the faculties from Bliss Institute, Sharjah. And today I'm giving a video which is describing about the speaking task of Oet. Before discussing the task card, I can explain you something regarding ourselves. We have been here for the last 16 years and assisting medical professionals, especially nurses, for their language test as well as UAE examinations. So for any queries, you can contact us. Both we are giving examination supports as well as the process too. And today I will be discussing a task card. It was a recent exam question, speaking role play. And here it is given that an emergency department it is shown. So we know that from this setting, we have to identify whether the patient is known or unknown or any emergency situation it is there. So today I am going to discuss a setting which is including an emergency department. And here in this role play card, they have given that the patient is coming with a poisoning. Simple NSAID. So possible overdose of NSAID are here. And in this card, they are given that the patient has forgetfulness, vomiting, abdominal pain. So these all are the complaints of your patient. And one more information they are giving that you are assessing the patient in triage. So it is an emergency department and the patient has some complaint as well as they are and the nurse's purpose and you are assessing the patient. So it can be considered as an unknown case. So the nurse is assessing. So simply we can identify the problems of the patient. Yes, and you can start with how can I help you, or otherwise I can see that you are not looking fine, what happened to you, and the name also important in this task. So this is a setting and you can consider this case as unknown. And there are few tasks. So the first task which is depending on the reasons of patient visit. So as I said, unknown task, we can deal with an unknown task, or you can ask that how can I help you in this situation, because reason for the visit it is there. So it is one of the tasks. So you can ask some questions. And the second thing which is describing here it is find out the information. So more information means especially the medicines which they have taken and number of tablets, how many it is. Then only we can consider that it is an overdose case. Then the symptoms. So already he has some symptoms like forgetfulness, vomiting and abdominal pain. So any other symptoms you can find out, especially with any respiratory issues. Here it is given that. Then after this another task it is there, advice need for test and identify the symptoms. So once if you are taking something from your patient, the next thing is to identify or for the diagnostic test which we have to confirm the thing. And here we are nurses, so we don't have any right to diagnose the patient. So usually suspecting cases will come under. So we have to explain the diagnostic tests for the patient, for the confirmation, and the next step is to send the patient to the doctor. So here also there it is given that the steps for assessment, especially the blood test and all. Then resist request for diagnosis. As I said, the doctor should assess the situation exactly with the report. So you can explain the patient regarding the importance of diagnostic test, why they need and what is the relevancy at this moment and how this will help the doctor to diagnose the problem. Then finally offer to discuss some antiemetic medication with the doctor and establish patient concern. So the thing is that you can explain some medication detail and the doctor is needed for the medicine, as well as you have to make your patient comfortable as well as consent. So once usually the student may get confused regarding a word which is seen that consent. Actually they are reliable with something which written consent. It's not a written consent they have mentioned here. It's a verbal consent. So they have to obey the rules. So we can discuss with that. So don't get confused with once if you see a word consent. So most of the tasks there is a word consent of the patient. It may be verbal as well as it will be written to. So we have to be clear with that. Then ask the patient to take seat, wait for the name to be called, initiate the test. The thing is that you have to make sure patient and assure your patient and make them ready for the test first. So simply from this task we can identify that it is a simple task which is discussing regarding an overdose of some medicine, and the nurse's duty is to convince the patient for diagnostic test. So first of all, we have to explain the seriousness of the situation. It is a poisoning, so we can explain little more things regarding the seriousness and the relevancy of the test. Then the next thing, because of this diagnostic test only, they can get a diagnosis proper. So next you can connect with this diagnostic test reports plus the doctor's visit. So this will be the main thing coming under. And finally, whenever you are finishing the task, you can make a consent from your patient and assure that they can wait for the test, and you can make your patient comfortable. So likewise, this task can be solved. And in between, as I was always am mentioning you, that there should have an introduction and a briefing should be there, as well as listening techniques. You can maintain listening techniques whenever they are speaking. You have to use some listening techniques. And finally, make sure your patient is identifying everything, and everything should be made under the assessment criteria, especially speaking assessment criteria. So I think if you're focusing on all the assessment criteria, definitely you'll crack it. So the next video will be discussing more about the speaking, writing, listening and reading tasks. And for any queries, you can contact the same number, as well as you can contact Bliss Institute Sharjah as well as Bliss Academy Kottayam. Thank you for watching the video.